Hi Mom, I hope you're feeling better because I'm about to give you a lecture on what happened to your heart. Okay, so as you well know, all muscles in your body require oxygen to survive and to function and to contract and do their happy little muscle activities. And you probably also already know that it's the heart, let's say this is the heart, that pumps oxygenated blood to the rest of your body. But here's the thing, the heart itself is made out of muscle as well. So how do the heart muscles get oxygenated blood from the heart to the heart? So it does this through something called coronary arteries. Coronary meaning related to the heart, and arteries meaning blood vessels that take blood away from your heart. So as the heart pumps oxygen-rich goodness to your body's tissues, the coronary arteries ensure that the heart actually gets a share of this oxygenated blood. So to help you understand this even further, let's break down the structure of the coronary arteries. The coronary arteries actually start off pretty thick with a smooth muscle wall. And the reason why it has to start off thick is because it needs to resist the force that the heart exerts on it by pumping blood. These arteries are going to branch off into some smaller vessels that are called arterioles. So they start off as arteries, and they branch off into arterioles. And these arterioles are going to branch off into even smaller vessels, and we call them capillaries. And if you take a cross-section of one of these capillaries, this is what we're going to find. So if we cut this part and then we zoom in, this is the cross-section of the capillary. And this represents a heart muscle cell. Once oxygen-rich blood reaches the capillary from the arteries then to the arterioles, what it carries is oxygen and nutrients, but we're focusing on oxygen here. And this oxygen is going to diffuse into the heart muscle. And this is possible because the walls of the capillaries are now really thin, so energy is not required for oxygen to just pass through. And what the capillary gets in return is basically waste products such as carbon dioxide and whatever that the heart muscle doesn't require anymore. And that's what happens in a normal person's body. But what happened to you isn't normal. This should not lead to the symptoms that you experience, such as your dizziness, your headache, and your chest pains. So, what exactly went on in your body or your heart? Well, if we were to take a cross-section of your arteries or your arterioles, what we're likely going to find is that there is actually an obstruction. And this obstruction is called plaque. Plaque can be made out of many things, such as cholesterol, fatty deposits, or calcium, but that's not the point here. What we should focus on is that this obstruction means there's less space for blood to actually flow through. So if there's less oxygenated blood going into the capillaries, that means less oxygen gets to your heart muscles. And that was why you felt the symptoms that you did. And that was also why I called 911. You might also remember being in the ambulance and that they gave you a bunch of different drugs. So the first drug that they gave you was aspirin. What aspirin does is it prevents your platelets from clumping together and forming a blockage. Now, you might remember from your high school days that your blood actually has the ability to clot. And that's very important if you were to cut your finger, because if a clot doesn't form, the blood is just going to keep bleeding and flowing out, and you're going to have a lot of blood loss. However, in this case, a blockage that forms means that there's going to be even less space for oxygenated blood to flow. So aspirin is needed to thin your blood and to prevent these blockages to form. Another thing that they gave you was something called sublingual nitroglycerin. By the way, sublingual means that it's administered underneath the tongue because that's where it's going to be absorbed really effectively and efficiently. Anyways, so the sublingual nitroglycerin, what it does is that it dilates the blood vessels. That means that the diameter of your blood vessels, such as your arteries or your arterioles, are going to expand. And it does this because it relaxes the muscles that surround the arteries and arterioles. That means more space is available for oxygenated blood to flow through, and that means more oxygen gets to your heart muscles. And that also means your heart doesn't have to work as hard. I also know you don't like medications, but hear me out, okay? So your doctor has prescribed antiplatelet therapy. So if this were to be the cross-section of one of your blood vessels, platelets would not aggregate and they would not form clots like this that would block your oxygenated blood. The second class of drug that they prescribe you with are beta blockers. Now, you might have heard of the fight or flight response, which is whenever you're running away from something scary, your heart rate is going to go up, your blood pressure is going to go up, but with your condition, that's probably pretty bad. So what these blockers do is it suppresses your sympathetic nervous system, so your fight or flight response. And because of that suppression, your heart rate is going to decrease, your blood pressure is also going to decrease, and your blood vessel diameters are going to increase. Now, the doctor also recommended that you lead a less sedentary lifestyle. That means the third medication that you should probably not skip is exercise. Exercise is basically magical. Just look at all these benefits. The most important effect of exercise for your condition is that it reduces plaque formation. It does this by decreasing low-density lipoprotein, which is also known as bad cholesterol. It can also increase high-density lipoprotein, which is good because high-density lipoprotein helps remove excess cholesterol from the bloodstream, so it prevents the obstructions from forming. Moving can also improve your circulation, which further helps clear excess cholesterol and other fats from the bloodstream. Being less sedentary also means that the muscles in both your body and heart would use oxygen more efficiently, lessening your chances of another instance of your chest pain symptoms from occurring. Furthermore, exercise promotes the formation of new blood vessels, which leads to more delivery routes to drop off oxygen for your heart muscles. I can go on and on about the other advantages of exercise, but if I do that, we'll be here until next week. So let's move on. So you asked me what the prognosis was. Well, if you continue taking your medications, so you take your antiplatelets, your beta blockers, and your exercise, well then your mild myocardial injury is likely going to stay mild and maybe even reverse and go back to being normal. However, if you were to ignore these medications and stay sedentary, well then your mild might become severe, and that would lead to an increased chances of you getting a heart attack or even worse. So please, Mom, take your pills.